Hi everyone, welcome to today's episode on HealthyYou. And right here with me is Dr. Aaron. Can we meet you, Doctor?
Thank you very much. It's nice to be here. My name is Dr. Aaron. I'm glad to be here. Thank you.
Nice to meet you once again, Dr. Aaron. And today's episode on HealthyYou, we're talking on the medical condition hypertension. What is hypertension, Doctor?
Hypertension in simple terms is elevated blood pressure, which we measure with a stick and a state. Whenever we get the values above 140 over 90, we term it hypertension. But here is the catch. You can't call you hypertensive because hypertension can be defined by so many things. So if it's hypertensive figures we are getting, it has to be on 2 different occasions or 3. So the mean of these 2 will give us a picture that this person is hypertensive. So we can't judge with one view.
So what do you mean by different occasions?
Now today you're in the hospital, we see you and then we measure your blood pressure and it's high. It's above 140 over 90. Today, you go home, come on a good day again and then we check again, maybe around 3 days apart and it's still within that same range. Then we will now see your hypertension.
So on different days and different intervals, then you can now conclusively say that someone is hypertensive.
Yes.
Okay. So why is hypertension very dangerous? Why is this an emergency condition?
Okay. Hypertension is not necessarily emergency, but it's a very dangerous condition. The reason is that it doesn't speak. It's silent. In fact, most people who are hypertensive don't get any symptoms. They only feel symptoms when things are bad. So I would call it a silent killer in medicine. So it has several damages it causes. Let's start from the head. That situation can cause stroke. Okay. It also cause long-term loss of sight, which we call glaucoma. Okay, it can cause confusion, it can cause chest pain, it can destroy the kidneys. Okay, a lot of factors in the body, it can destroy end organs. There's just a whole lot the stuff can cause, but because it's silent, we don't know things are going on until there's a problem.
That's a lot of causes. Because now you're talking about the causes of hypertension. So can you just outline it more clearly to us so that we can easily understand?
Okay, thank you very much. Hypertension has several causes. Okay, we divide it into modifiable and non-modifiable risk factors. So this is where genetics come in. When I mean this, I mean that it's been shown that in the black population, people who are black, there is more of tendency to be hypertensive. Okay, and then the other age can be a factor. There's also the modifiable factors where what you eat. We say we are what we eat. So there's someone who consumes a lot of salt. That's part of it. A lot of fatty food, processed food, okay, that have salt. That's processed food and all that. And this is where smoking comes into the causes too. This is where living a sedentary lifestyle where you are not active at all, you sit at a place all day, instead of walking to your office, take an elevator and all those. So these are various risk factors that expose you to having a chance at having. And this is it can be changed. You can do nothing about it. You can modify this lifestyle, stop eating all these things that cause it. So these are things that lead you to having hypertension. Thank you very much.
Okay, that's hypertension can be have 2 causes, modified and non-modifiable. So that means those causes that are not modifiable, you have no role to play.
Or we can manage it.
We can manage it. But those that are modifiable, that means it's on our own part to make sure that we don't come down with hypertension. That's very interesting. So are there signs and symptoms that one can see and you know that okay, yes, this person is hypertensive? Are there signs and symptoms of hypertension?
Yes, basically when somebody is hypertensive, like I said earlier on, it's a silent disease. Okay, when we start having symptoms, it's gotten bad. I forgot to mention there are grades from GNC. The normal tension, that's the normal blood pressure of a person should be less than 120 over 80. So when we have 120 to 129 and over 80 to 89, we're looking at elevated blood pressure, right? So when it's above 130 to 139 and then 90 to 99, that's about stage 1, okay, that the stage 2 is when we have from 141 to 159, okay, and over 90 to 99, okay, that's stage 2. They also have where we have above 160 and over 100, that's stage 3, okay, which is severe. At this point, we still having symptoms, started the symptoms coming. So let's start from the head.
So that means there are 3 stages. It has 3 stages. And symptoms doesn't show up until the person has gone to the stage 3 of hypertension.
Correct. That's why I said earlier that's the silent killer. So by the time we are having this blood pressure to this extent, we're still having symptoms. That's why we now go to complaints. Okay, you have your headache, still I'm having headache. Person moves or climbs stairs. Person becomes breathless. Okay, person feels like resting after taking a short walk. The person can have abdominal pain. The person can have chest pain. Okay, the person can even have muscle cramps at the back of the leg, even on the thighs. Okay, so the person complains of pain at these extremities. At some point, even the fingers look like there is sand inside it, so they have peripheral neuropathy. That there is pain on the tips of their digits. Okay, so there are other several symptoms that may even come up. The person may even complain of having erectile dysfunctions. The person have issues with having reduced urine. So a person can even complain of blurring of vision. Remember I told you earlier that it affects the eye, so it's plus the person has vision that is reduced. So these complaints give us a picture that this could be it, and then when we check normally, that's what we see.
We wait until we have these symptoms before we can see the doctor.
Now look at the thing. I told you this is a silent killer. When we are seeing these symptoms, things like this is the evidence of end organ damages. So we shouldn't get to this point, okay? So what we need is you need to show up at the hospital and know okay, I mentioned earlier that there are factors that are non-changed, that cannot be changed. It's because you're a black person, okay, and because age is a risk factor. Once, for men, once you are above 35, please check your BP at least 2, 3, 4 times a week. Because it's silent, you need to know what it is per time. Because it doesn't make noise and it keeps getting bad. So you don't have to wait to get those symptoms. When you get that symptom, then there is a problem already. So
that means the signs and symptoms, they are already indicating
that there is an issue on ground. So before those issues come up, but the body has a way of adjusting at some point. The first time you notice the study, okay, people have complained that they're in the bathroom and they felt dizzy. It's a big sign. Come on, it's not something you come to the hospital.
So what do those people that now go over the counter to just can quickly get medication?
Right, that's our problem in around part of the world. So here's what I tell people: see a doctor. Have a doctor you are seeing. Open up on how you feel. A doctor can save you. Over here, people come to the hospital when things are bad and expect miracles. Every disease is curable when we see it on time. When it's a little elevated, yes, once you have early detection, get to work on it and will save you and you have a normal life. But people come when they have visited so many places and then come for formality to be done. Then we can do our best, but I wish the person would know how to, would have learned, or whoever is watching learn that you need to come to the hospital in time when you can walk with your 2 feet and not when you are carried. Thank you very much.
Wow, that is very, very, very impressive. Now, can hypertension be prevented? Because now we have known the signs and known the causes. What are the things to be done to prevent hypertension?
Let me give you a very good example. It's preventable. Now, when there is a room and then we set fire and this room is smoky, how can we make the room to stop getting smoky? By putting out the fire, right? I say something about age. I say something about other factors. If you can take away these factors, I remember telling you that excessive salt in the diet is a risk factor for this stuff. So if a lot of salt in your diet will cause blood pressure and you reduce it, what do you obtain? It also increase the blood pressure. If incidentally that you don't exercise, it's a risk factor to hypertension, and you start exercising, what do we get? Reduced BP. So these things are things that can modify if only you can change your lifestyle. You stop eating nonsense, processed food and all that, and that have salt.
Now that we have more processed food, more seasoned food, so how can we now go about it? Because the fast food and everything is easy to take home.
Yeah, you see, health is an intentional something, right? If you want to live long, you need to make it a point of duty to stay with nature. nature has been so gracious that we don't have a lot, okay, that affects us in nature, okay. But when we now need to store these foods in cans and tins and and preservatives, then we're using ourselves and our body to factors that can cause this body to have issues. So fruits and vegetables is the go-to diet if you really want to. Okay, come on. Those days when our elders, when we have not developed this much, they had contact with, they come out from in the morning, look at lifestyle then, they go to the farm, the person is exercising, he drives his bicycle to the market, exercising, he comes back in the night, they go to their farm, they collect vegetables, all natural fruits. They were living 100 and something years, and their BPs were normal. But when we start eating these things we eat in our generation,
was there any way to actually get to the conclusion that BP was normal? Because then there was no BP apparatus to check, and we can we medically say that their BP were constant, we are normal till their old age?
There are ways to note this, there are factors to, and indices to this context. Those days, we only have people having stroke.
Okay.
And stroke is the sequelae of hypertension. We had people, very less people having kidney, if it was not here, okay, having kidney issues. And hypertension is a very strong risk factor, just secondary to diabetes, in causing kidney issues. Okay, and then our parents, there was no need for dialysis around this place, because then these people were living active lives. I saw a man, 90 years old, he was driving a bicycle, he could still climb up a tree. Come on, that kind of strength. When you do this day, for example, the woman, she needs to, she needs to enter elevator to this place. She needs everything is modified and mechanized. Why wouldn't they get?
But I'm living in the season of life made easy, soft life, and you don't need to stress yourself. So why would you want to go through the stairs when there is an elevator?
That is why health is intentional, right? You want to live long, right? It's your choice. Then do what you need to do to live long, all right?
So you have to
in the midst of abundance, you have to choose to intentionally work your body. And this is it's not so difficult. Just about 150 minutes of exercise a week.
150
minutes of exercise a week. About 7 days a week. Okay, so this gives us about 20 minutes or so, right? Of exercising a week. Can keep you healthy for a long time. So every day 20 minutes of exercise. It doesn't have to be much. Wake up, walk down, sweat, come back. You understand? A little squatting, a little jumping, just movement, lifting weights, just 20 minutes a day. Just the main thing is the daily practice. It's not in coming on Saturday and working out and the whole day of the week, nothing. So if you're able to keep it as a life, beautiful, you having a normal, and the studies show that for every 10 kilogram weight you lose, your BP drops by 15 millimeters of mercury. Okay, so if let's imagine that you're weighing 90 kilogram and your blood pressure is 150 over 100, all right, and you drop 10 kg, your blood pressure when checked will be at 135. Okay, over about 75. Are you seeing that? So exercise is a very strong factor. So we now have more cars and less activity. We have more machines and less human effort, and then it's giving us a return on a health decline. So there's a balance to this thing. I know you have a car, I know you have things that are driving you. Intentionally wake up in the morning and take little step. Intentionally walk back from church. Intentionally take the staircase and the elevator. These are things you do because there's a goal. Health, that's our standard. Thank you very much.
Oh, that's very interesting. I learned a lot from just this very simple explanation that you give to us now. So now you're trying to tell us that it's much easier and cheaper to maintain a very good lifestyle.
Yes.
It's much more easier. 20 minutes of exercise, it doesn't take much. Eating healthy doesn't cost as much as this processed food. So now, is hypertension curable? Because one cure hypertension. If it's curable, then if it's not curable, how can it be managed over time?
Hypertension is curable and also not curable. Let me explain myself. It's curable if you know, I made an example earlier on about a smoke in a room and taking out the embers of the fire. So when you realize that you are overweight, since I'm modifiable risk factor, I choose to work on your weight and reduce it. What do we get in return? If you withdraw, what have we done? We've been able to treat or cure this hypertension, right? Now, for in medicine, basically we manage. Alright? Let me give you an example. Somebody may have had an accident or something, right? I cannot move like that again. And he's hypertensive already. So the person will not be helped. So that's where drugs come in. Alright, so there are drugs in medicine that we give patients. Okay, I think that this could use CBD, alright, calcium channel blockers, diuretics, and beta blockers. These are the first lines, okay, we used to take. So it's curable in the sense that if you modify your life, you get better life, you stop eating nonsense, stop smoking, stop taking alcohol, and all that. Obviously, things will come back to how it was. Okay, now in case they're not able to do this thing because of certain comorbidities, like certain illnesses we are having, okay, we can now use drugs to help you. The word now is control. The word now is control, not necessarily eliminates the stuff entirely. We keep maintaining and control so that you maintain a normal life, so that we don't get that high to cause further organ damage. Thank you very much.
Because there's a general saying that once a BP patient, a hypertensive, once you start taking medication, it's lifelong till you die. So people are now scared of starting the medication because they already have this motion or this mindset that once I start taking BP drugs, I can't stop. So instead of them to start, they just end up not taking at all. So they tend to use other methods to control this BP, as you said, maybe going through using these herbal mixtures that we normally call abu, and other ways they deem fit. So that's what I was asking now, what are the measures? So now you're telling me that it's curable, that once you can modify your lifestyle and everything, BP can be cured. Okay, thank you very much.
Please, let me add something very quickly, okay? Please, as a doctor, I work in a place where I see kidney patients, and when I x-ray them, I see a lot of them telling me that they had contact with this, our concussion, our natural concussion. They are, please, if you're out there, I beg you, stop, don't take it again.
But it's all right. Testimonies of it's what
believe you me, okay? Those things may have the good and bad side, okay? But because those things are not graded, you are likely to be overdosed on those stuff, and there has never been a time when overdose of anything is good, including water, right? So you need to please come out of it, okay? See a doctor, discuss your medical condition, and then get tailored medical care for you. Everybody has there's specific medicine for everybody. So when you come and we check, okay, which works for you, it controls your better. Okay, so people can come with one therapy, one drug, and maybe do two, maybe three. Actually, I feel when people run from drugs is because for me as a child, I didn't like drugs. It was bitter, right? And there have been notions about drugs, and like you said, once you start, you continue for life. But I, for one, I used to be hypertensive sometime last year. Yeah, I was a young man, and I realized one thing: I was weighing 96 point something kilograms. You see, so I told myself, I know that if I change, I was doing BP as much as 170, 110. I was at the emergency level. At some point, it was so bad. I even had this nose bleeding while I was working at my office place. I think I fainted. I lost consciousness at some point. It was that bad, so I realized that I'm even the problem. So what I did was I just started taking drugs. I saw a doctor. I was placed on drugs. But I knew that what would give me the long-term effects is lifestyle modification. So as the drugs were able to reduce the BP down to normal, I can tolerate exercises. But then I couldn't tolerate exercises because I was breathless. So when we produced this more, I began to work out. I began to jog every morning for more than 3 months. I think I went from 96 kilograms to as low as 82 kilograms. So obviously there was a decline in my blood pressure. I was now comfortably doing 110/70.
What's the best medical advice you can give to persons that are yet to come down with hypertension?
Okay, I think recognizing the fact that hypertension exists from this video is one thing you should take home with, and the fact that it's a silent killer, it doesn't make noise. So I think advocate that every family, and if possible, every individual above 18 years should have a blood pressure apparatus at home. So that is ideal. You wake up from sleep, check your blood pressure. You wake up from before you get to bed at night, you check. Right now, it's going to help you know, because some of these things are automated to say this is high or low. So if it's high, you need to go and see a doctor, right? Now, if it's normal, you know you are okay. So these are the things. This will help also. That's part of preventive. But that's something medicine should be. You shouldn't always wait till it gets down to the curing aspect. You should preempt it and then prevent it. Okay. Another thing is I also feel that our people should learn to active. Take a cue from the Japanese people. They are very active. They walk around, do a lot of things, even despite loss in that context. Please try your best to get at least 20 minutes of exercise every day. Like I said before, the aim is not in the number of hours, it's in the consistency. Because the output is seen not on that day, over the time. You see that you are very fit, right? Your blood will pump, or in fact you breathe better, you feel lighter, you feel more alive, okay? Then please advocate every family, take away the table salt. Whatever is not on the fire, don't add again. Eat it like that. Alright? Avoid processed foods. Most of these things are stored with a lot of salt. Cream crackers, all these biscuits, they have a lot of salt, baked stuff, the bread. Just do less of it in a week. Let it not be every morning bread, the thing is compiled all the time. So do less of it, okay? Try and get closer to nature. These are fruits and vegetables. Luckily, we're in the tropical region. There are a lot of them. We have, pawpaw, banana. Just do fruits, fruit salad. Just eat fruits. Please take fruits at least 4 times a week. Okay, it helps clean up your blood vessels. Exercise, get good rest. We stress the factor too, right? So get good rest. Most likely you have your BP as normal as ever.
So if you're then just 18 years old, doesn't mean that younger persons are now prone to having hypertension.
Sadly, that's what we've seen in recent times. Okay, and of course you can understand the way we eat food in the recent 10 years has changed. And in my practice, I've seen a lot of young people. I've seen young people as young as 12.
As young as 12?
Yes.
So that means it's now...
So there's it used to be a disease of the aged, but presently, alright, it's good. Especially when these factors are there, like I said, the family history of hypertension is the either of the parents. The children should be very careful with the checking. If people are known to be on the big side, obese, you are at risk. So you can get a person who is 15 years who is very weak. Obviously the BP might be elevated. There's no other fast food to this. These are things you watch out for, and then you are careful. Okay, this could be fine. If wherever there are fat people, there are chances of high blood pressure. Wherever there are people that take a lot of salt, like I said before, there are people that have hypertension. So like I said before, please take away table salt. It's not good for you. Whatever the thing tastes like in the fire, leave it like that.
People that like well seasoned food and everything, so
it mustn't be that sweet. Please save your heart. Salt is not very good for the heart. Whatever salt is, water follows, and it will keep your blood vessels engorged and bloated. And then, just if you can reduce your intake of salt for the next 1 month, I'm sure you see a lot of big difference. Alright, it's proven. Thank you very much.
Thank you very much, Dr. Aaron. It's nice. It was really nice to have you with us on today's episode on HealthyYou. I really enjoyed myself. I don't know about it. It was really educating. And right now, I believe that with this so much knowledge that you have dished out to us, there will be a lot of changes and testimonies even on the comment section. And we'd love to have you next time. And I believe that this is not going to be the only time. Be sure to subscribe. Don't forget to subscribe and hit the notification bell and keep yourself updated. See you in my next video. Bye.